Adolescence and youth mark the transitional period between childhood and adulthood. In Ethiopia, almost 34% of the population is in the age range of 10 to 24, according to the Ethiopian Demographic Health Survey. This is a crucial period for human development and the basis for good health. Intercommunal conflicts and cultural, social, and economic barriers have been challenging young people and women, especially young girls, in West Guji and Gedeo zones of Oromia and SNNP regions respectively, to access health-related services. The UNFPA project funded by KOICA aligns with the priorities of the government of Ethiopia, aiming to empower adolescents and young people between the ages of 10 to 24. It promotes rights related to sexual and reproductive health, prevention and response to gender-based violence, and gender equality. The project aims to provide information, services, skills, and opportunities necessary for a successful transition into adulthood. Elsabet and Dawit are a young couple. They are going to the Adolescent and Youth Center in their qabali. Elsabet and Dawit have been a member of the space for almost 2 years now. It was in the youth-friendly space that the married couple learned about comprehensive sexual reproductive health and family planning services.
አግብቼ እዚህ መምጣት ጀመርኩ። ስለ ጤና ነው የሚያስተምሩት። እንዴት መከላከል በሽታ ባላዘር HIV መከላከል እንዴት እንደሚወሰድ እንዴት ጤናማ ሰው መሆን እንዳለብን ነው የሚያስተምሩት።
UNFPA works to enhance the capacity of young people to access and utilize quality sexual and reproductive health and family planning, as well as gender-based violence response information and services. In its 5-year span, the project worked on improving the knowledge, service-seeking behavior of women, men, girls, and boys on sexual and reproductive health, family planning, gender-based violence through skill building, increasing participation, and reaching them with tailored information and services. Platforms like adolescent and youth-friendly spaces and women and girls-friendly spaces help to achieve these interventions.
በወጣቶች ዙሪያ እንግዲህ ይደግፈናል ብለን የምናስበውም ያለንም ትልቅ ፓርትነር UNFPA ነው።
Asras is a health worker at Gedeo Health Center. He helps young people like Elsabet and Dawit providing information and service on sexual and reproductive health and gender-based violence.
ያው እዚህ ስነተባልዶ ላይ ብዙ ነገር እንሰጣለን ወጣቶቹን age እናስተምራለን.
In the center, youth like Elsabet and Dawit were provided with culturally appropriate information and services. The center provides services such as family planning, psychosocial support, group and individual counseling, and recreational activities. Referral linkages are made to one-stop centers for case management on gender-based violence and youth-friendly service corners for sexual and reproductive health services.
ብዙ ትምህርት እንሰጣቸዋለን ለወጣቶቹ ሳገቡም ካገቡ በኋላ መጠቀም አለባቸው ካገቡ በኋላም ደግሞ ምን አይል ያራቁ መጠቀም እንዳለባቸው.
A total of 44 youth development platforms, meaning 36 strengthened and 8 new platforms, were equipped with relevant material support such as furniture and edutainment materials, in and outdoor gaming equipment, computers and other office supplies were provided to make centers more youth-friendly. These youth development platforms are also capacitated through capacity-building training on club management, life skills and entrepreneurship, and through the provision of IEC materials. The project used peer education as a tailored social and behavioral change communication strategy, focusing on value clarification, enhanced knowledge on HIV, sexual reproductive health, gender-based violence, and service-seeking behavior among in and out-of-school young people. The project also used other social and behavioral change communication approaches like radio programs, outreach, Her Space Initiative, and printed materials.
አዶለሰንት ዩዝ ላይ ወይም ደግሞ ወጣቶች ላይ ሰርቪሱን ለብቻ እንዲያገኙ መደረጉ በራሱ ትልቅ ለውጥ ነው ብለን ነው የምናስበው።
የቤተሰብ ምጣኔ ላይ ወደፊት የምናስበው ነገር የቤተሰብ ምጣኔ ለማድረግ ወስነናል።
ስለ ኑሮም በያሰብን እኛም ደግሞ ልጆች ነን ገና ያደግን ነው ብዙ ነገር ይጠብቀናል።
The Women and Girls Friendly Space is another place where women and girls access information and services. With its implementing partner, DSW, the project supported the construction of 2 women and girl friendly service centers at Haroresa and Bulle Hora health centers of Gedeo and West Guji zones respectively. It also deployed social workers to facilitate the women and girl friendly service activities and provided counseling and referral services. Women and Girls Friendly Spaces serves as an entry point for information sharing on available services and support, as well as a safe space for survivors of gender-based violence.
እኛ በብዛት እዚህ የምንሰጠው የምክር አገልግሎት ነው። እኛ ሪፈር እናደርጋለን። ጤና ጣቢያው ደግሞ በቂ የሆነ ለነሱ ሕክምና ያደርጋል ማለት ነው።
Hanna and Mirtanesh are members of the Girls Friendly Space at Bulle Hora Elementary School. The name of this group is Bekashe, meaning her space. In this space, girls learn about their sexual reproductive health and rights and gender-based violence.
በብዙ ነገር ይጠቅማል። ሴት ልጅ ምን ማለት እንደሆነች ራሷን ከምን መጠበቅ እንዳለባት ብዙ ነገር ተምረንበታል። ቀኛም ተቀይረንበታል፣ ልጆችንም ቀይረናል።
Galana Primary Hospital is new, and it is one of the health facilities that received support from the project. Before the construction of the hospital, service seekers used to visit health facilities by traveling great distances. Adanich is here at Galana Hospital to give birth to our 5th child. Delays in receiving appropriate care at the health facility due to lack of equipment, essential drugs, and life-saving supplies are among the factors for the tragically high maternal and perinatal morbidity and mortality. UNFPA's KOICA-funded project works on strengthening the capacity of health institutions to provide comprehensive and quality sexual reproductive health and gender-based violence services. The project supported these facilities with essential equipment for the provision of emergency obstetric and newborn care and life-saving sexual reproductive health services.
ግብአቶች በተለይ UNFPA በዞኑ ውስጥ ካሉት ወረዳዎች ለሁሉም ነው ሰፖርት ያደረገ። ከ33 በላይ ጤና ተቋማቶች ናቸው ግብአቱን የተጠቀሙ።
Galana Primary Hospital and Dilla Teaching Hospital have received operation theater tables, anesthesia machines, ultrasounds, neonatal resuscitation tables, and emergency reproductive health kits. Adanich is the first mother to receive emergency obstetric surgery services at Galana Primary Hospital. UNFPA supported 24 health facilities to enhance the delivery of quality maternal and comprehensive sexual reproductive health services. To strengthen the referral system, the project also procured 2 ambulances for the 2 zones, one in Bulle Hora Warada of West Guji Zone and the other in Gedeo Warada of Gedeo Zone. The project strengthened the health system by increasing the number of trained frontline SRH and gender-based violence service providers to give quality and comprehensive SRHR and gender-based violence information and services with respect and compassion. This was done by providing capacity building for frontline workers at the health facilities and by strengthening the referral system between different services.
ትሬኒንጎች ተሰጥተዋል። አንደኛው ትሬኒንግ ክሊኒካል ማኔጅመንት ኦፍ ሬፕ ነው። ሬፕ ሰርቫይቨርን ማኔጅ የሚያደርጉ ሐኪሞችም ሆኑ ሌሎች ነርሶች ትሬኒንግ አልነበራቸውም። ትሬኒንጉን ከወሰዱ በኋላ በጣም ጥሩ ለውጥ መጥቷል ማለት ነው።
The one-stop centers provided quality and comprehensive gender-based violence prevention and response services for survivors. Hanna is one of the survivors who was supported by the project. She and her sister were sexually abused by their father. The establishment of the one-stop center has helped survivors like Hanna to access services like psychosocial support, clinical management of rape, protection, legal and other integrated SRH services.
ራስሽን እንዳትጎጂ ይሄን ነገር በምንም አትቅጠሪው። አሁን አንቺ ከዚህ እናትሽን ብቻ ለማገዝ እናትሽን ለማርዳት ብቻ ምንም ሞክሪ ያለሽ።
The project helped the one-stop centers by procuring and providing furniture, medical supplies, setting up a toll-free call center, and equipment, including post-rape treatment and dignity kits. The service providers such as Warada Police, Justice, and Women and Children Affairs offices were trained on gender-based violence case management. After being admitted to a safe house, Hanna and her family have received justice, now that their father is serving 20 years in prison. In the Dawit Elementary School in Dilla City, students are given dignity kits. The kits are essential in preserving the dignity of women and girls to maintain their self-esteem. This distribution session served as an entry point for sexual reproductive health and gender-based violence information dissemination. The project supported 2,200 young women by providing dignity kits containing basic hygiene and sanitary items, as well as other supplies such as hand torches and headscarves. These kits are essential in allowing budget substitution for families to purchase other necessary items and reducing school absenteeism, especially among poor adolescent students. The project also strengthened the capacity of community-based structures to respond to human rights, gender-based violence, and sexual and reproductive health rights issues faced by women and girls. The project gave due recognition to the importance of engaging community-based organizations and faith-based organizations to address deep-rooted social norms that perpetuate silence around gender-based violence and hinder the healthy development of young people. Mobile health teams play another important role in raising community awareness on sexual and reproductive health and gender-based violence information. Community service providers such as health extension workers, women development armies, and outreach workers are supported to enhance their skills and knowledge in order to strengthen the link between community-level interventions and structures. UNFPA's KOICA-funded project made key contributions in making accessible information and services on adolescent and youth health. Improvements have been witnessed in young people's access and utilization of quality and comprehensive sexual and reproductive health and rights and gender-based violence information and services in the project implementation waradas in the West Guji and Gedeo zones of Oromia and SNNP regions, respectively.